Our next presenter is Brendan Brown, who's the Director of Evaluation Impact with Green and Healthy Homes Initiative. Basically, we're going to be zooming out and looking at what organizations are doing on a national level. So Brendan, I'm going to stop sharing right now.
All right. Thank you, Kellen. You should be able to see my slides
looking
now.
Good.
Excellent. Okay. All right. Well, good morning, everyone, and thank you, Kellen, for the introduction. I'm glad to be here representing my organization, and basically we'll be presenting an overview of the Green and Healthy Homes Initiative model. But I'd like to thank my partners at Bayren for inviting us. And we'll go ahead and get started here. Okay, great. First, I'll start off with a little brief history and explain our mission at Green and Healthy Homes Initiative. But then I'll cover, three areas where we're working to achieve equity by integrating energy, health, and housing. One is through research into racial and social inequities related to housing. Another is how we're addressing these inequities with energy cross-sector partnerships with using energy efficiency and healthcare financing. And we'll also look at some kind of examples of, like Kellen said, of some national work we've done with other states and other localities. So some pathways to actually implementing these models. All right, great. And so I'd like to say, our mission for a long time has been, breaking the link between unhealthy housing and unhealthy children. We have expanded that in the last couple of years to be advancing racial and health equity and opportunity through healthy housing. This is directly related to our mission of trying to address the social determinants of health and advancing racial and health equity through the creation of healthy, safe, and energy efficient homes. And the way we've been trying to put this into practice, in both internally and as we work as kind of to support other jurisdictions to do similar types of comprehensive housing interventions, we're really trying to ensure that racial equity is at the center of all policies, practices, and actions that we're working on. In fact, we've just completed a 9-month internal process to develop a racial equity action plan that we've begun to implement, and in the near future, we'll probably be sharing that as an example. But real quickly about our history, we were founded in 1986 as the Parents Against Lead, a number of parents that lived in East Baltimore whose children were being severely lead poisoned came together as a advocacy group, which led to in 1991 the formation of the Coalition to End Childhood Lead Poisoning, a nonprofit 501c3 that's been led by our CEO and President Ruth Ann Norton. And they spent a lot of the early 90s work doing direct services and advocating for legislation in the state of Maryland to prevent lead poisoning among children. This has resulted since that time in 1992 in a 99% reduction in lead poisoning. So, trying to not only do the services, but thinking what are the best practices and how we can link those to policies has been very important to our mission and our history. In 2019, we expanded the scope and scale to look at other, unhealthy housing hazards. I mean, as we had done direct service work in Maryland, we'd expanded into doing asthma home visiting programs, fall prevention, home safety for children, and we continue that work to today. This led to EPA Asthma Award for the Environmental Leadership Award in Asthma Management in 2015, as well as a couple of funding opportunities from the Social Innovation Fund and Robert Wood Johnson Foundation, where we explored innovative financing, specifically Pay for Success, as a model to try to pay for some of these comprehensive housing interventions. And so this has also led to us to develop 2 national initiatives, one around national lead, our National Lead Summit, and another one that I lead around the National Initiative for Asthma Reimbursement. Okay. Let's try to go. There we go. one too far. So how does this work? The implementation of the GHCHI model is that we support local programs to help them align, braid, and coordinate funds, just like Chris and Laurel were discussing before. How do you, make sure that the families in your community are getting all the services that they need? And it's through, developing a comprehensive asthma or comprehensive housing assessment, and then trying to find the resources that are present, or find new ways of funding to actually complete those whole house interventions. And we've done this in a number of places. As you can see here, we have over 65 partner sites nationwide. Marin County is one of our 33 GHCHI sites that have adopted a compact that clearly states their goals and intentions. So now the question that might come or next is, so how have we been working in other ways to kind of establish health and racial equity at the center of housing interventions? Is I'm a researcher, public health training. So we've starting in 2009 when we became the Green and Healthy Homes Initiative, we've worked on a number of publications, research, production of our research efforts, looking at, originally looking at what are the barriers for people getting weatherization. So we found, in multiple cities that we looked across, that the deferral rates were really high, that there were turnoffs, high rates of turnoffs, even in these houses that didn't get services, which can lead to, eviction and housing instability. We continued that great work with part of the, during the ARA funding, or the American Recovery and Reinvestment Act, from 2008 or 2009, I think it's 2009 to 2014. And we worked with the Weatherization Plus Health Initiative. In some of the policy work we there was allowing for more health and safety measures to be completed as part of the normal operations of weatherization. And then we've had a series of publications around non-energy benefits and the equity of providing those types of investments to promote better outcomes. And I'll talk about a couple of these here. But the reason why we've invested a lot of time in researching and looking for best practices and trying to build business cases is because there's a known problem of unhealthy housing, is that it creates a large burden on our communities, and particularly in communities of African American and Latinx communities. These burdens are a disproportionate share of this burden is experienced by those communities. So we think it's important to find ways to get upstream investments into these communities to prevent what you see here is, families living in unhealthy homes have greater incidences of asthma, exacerbations, and attacks. They have greater incidences of slip and fall injuries, as well as home safety, child injury. These all things can be prevented with the right kind of investment. And so one of our kind of major publications we did 2018, this came out in January 2018, was Achieving Health and Social Equity Through Housing, Understanding the Impact of Non-Energy Benefits in the United States. And we looked at all the different pathways that the comprehensive kind of interventions, those that include energy efficiency, that electrification, taking out the natural gas appliances, weatherization, and healthy homes measures. Like, what are all the different pathways? So we explored not only, it wasn't so much around the energy outputs and energy benefits, which are important and are part of it, but really looking at the non-energy benefits and outputs, so around improved air quality, increased thermal comfort, reduced exposure to environmental hazards. And so what are the benefits of these? And we directly linked it to public health goals, and kind of had a lot, linking these to Healthy People 2020 goals in particular. And then also thought about how does by having these, by achieving these goals, what are some of how do those actually link back to longer term impacts, which in a lot of cases are the same social determinants of health, right, that are causing a lot of this inequity in these communities. So, and just real quick, this is a publication kind of extending those research efforts. I think this one was in 2019 by my colleague Jamal Lewis, Diana Hernandez, and Arlene Geronimus at Columbia University, specifically looked at what are the issues that are brought in the African American community related to energy insecurity, and you can see those listed here. And this is it's a problem that's kind of ubiquitous throughout the United States in all counties and all cities, so rural and urban areas, but particularly, like I said, for the communities of African American and Latinx communities, this is a problem that needs to have more research actually conducted. And one other publication I'll mention, and then get to the next part of the session here, is another publication that my colleague Jamal Lewis and Carlos Martin from the Urban Institute had put out just in the end of 2019. And this publication explored 6 dimensions of equity that you can see listed here, and provided some specific energy efficiency examples of different types of measures that you can look at, but also other general examples of inequities. And so this is kind of I will say just a first, and I think a 2-part series. So we're also going to kind of in the next publication must probably explore what are those kind of measures that fit in these different dimensions of equity. And so this slide really kind of encapsulates the work that we do with the GHCHI model. It's a whole house strategy. It's based on a combination of providing resident education, assessing, doing a comprehensive assessment, and trying to then, find the funding to complete those home modifications. And so some of our major, health hazards that we're trying to address is lead-based paint, asthma triggers injuries, radon and asbestos, as well as energy efficiency and weatherization, improving thermal comfort and quality of life of residents. And we think one important issue, right, is that you need to really think about cross-training assessors, educators, and crews. We spend a lot of time doing this. We even work with the Building Performance Institute to produce a micro-credential that energy auditors can get as a certified healthy homes inspector. And this is done. Oops, is that the right slide? Yep. Now, how do we, kind of the last slide showed what hazards that we're trying to address in our model. So how do we do it? We do it by aligning services and funding, which you heard a really good example from Marin County, and by braiding resources. So a lot of times this is being done at the local level, either at the county or, within a city. There are certain examples we'll talk about later of trying to do that at the state level, right? So less administrative work for those implementing the model in that case. But it's also about coordinating that delivery of services, and this is done through a number of things: trying to develop a single intake system, having a comprehensive assessment, coordinating these services, and these usually takes the time of administration and having strong partnerships, right, and being able to rely on one another to carry out the services once referred. And this can also be done by integrating the interventions, having lead hazard reduction programs, work with community action agencies, and again, cross-training and sharing data are also key aspects of the model. And the way that we try to get this cross-sector partnerships together is it also allows for different forms of innovative financing. So here on this slide, you can just see just kind of we call it our healthcare investment toolbox, but these are just different pathways to that the healthcare normally invests, or there's potential to invest in housing. So you have Medicaid CHIP waivers, state plan amendments. These usually take a little bit longer term, because they're only modified every 5 years. Hospital community benefits. This can be energy service providers, weatherization, community action agencies working directly with their hospitals in their community, like they do in Marin and Contra Costa. Also, like I said, we explored pay for success as getting third-party private investment to help pay for some of these services, as well as one of the ways we spend a lot of time working with managed care organizations directly, either to get kind of direct service contracts or even more beneficial to all parties, kind of value-based payments. There's also other, other healthcare financing available, especially through some of the new changes in Medicare Advantage plans, which gives those plans a lot more leeway in investing in, what they can call a medical expense. So this next slide just kind of highlights, we work all over the country. These are some of the different kind of health and energy partnerships. So these are cross-sector partnerships, all of these, and I'll talk a little bit about some of these in the next slide, but you can see Marin counties down there, Contra Costa Health Services and MCE are working together in that Michael Kent will explain in the next presentation. But the last kind of part of the session, I just want to give a few examples of some of the work that we're still doing. Besides the research and the policy, we're also doing evaluations. This is some results from a Healthy Homes technical study that we was looking at our GHCHI Maryland asthma home visiting program, where we had health education dollars that were covering what we call the Tier 1 services, but the Tier 2 services were, for the most part, energy efficiency dollars and weatherization dollars that we used to do the moderate and major structural improvements to the home and some of the health and safety measures as well. And so what you can see in this slide is the kind of the Medicaid total cost of care savings, and I'll point to that 1,658 per participant in 12 months was saved in the healthcare side. Just to kind of give you an example, for the energy savings, we were only be able to show that there was an annual savings of about $83 per participant. So if you're doing energy work, especially with these kind of vulnerable populations that are going to have health benefits, and you're not calculating these health benefits, these non-energy benefits, you're only seeing a part of the actual impact that you're making. So that's kind of the importance of this study. And you can also see on the right-hand side that even though we had greater cost for the kind of the Tier 2 services, had a very similar return on or a pretty good return on investment as comparable to the Tier 1 or health education services. And so this slide shows a number of state programs that we worked with. I'd given a couple programmatic examples, but real quickly here, I just want to run through just a couple of these, and then it looks like we're probably getting close to time.
Yeah, we got about 3 minutes, Brendan, but we can divert questions to the panel or breakout room. So
yeah. So I'll just finish real quick. But some of these we looked at kind of statewide data and what asthma, looking at fall prevention, looking at lead poisoning prevention, and each of these states that kind of, based on that research and data analysis, they were able to lead to direct kind of investment. So in NYSERDA, there's $10 million that they're going to invest with cooperation with the managed care organizations to implement a pilot. It's been it was supposed to start in spring of this year, but it'll been postponed due to COVID. Similarly, in New Jersey, we looked at lead poisoning. There's a $500 million bond that they're trying to pass to pay for those types of interventions. We're developing a similar kind of fund for Michigan. And in Rhode Island, we've also been, in Maryland, we've been doing a lot of cross-training. In the Latino communities, we've have developed a whole protocol to get more healthy homes trainings in some of these minority contractors to develop those skills so they can employ more people and be involved in more healthy homes work. And I think Laurel had mentioned this is another important thing is the CARES Act funding. A lot of these counties and city jurisdictions, this is funding that will be available, and a lot of them have to spend it in a certain amount of time. So it's a good avenue to explore right now. And these were just some more specific examples, but we'll end there. And that's my contact. And thank you for letting me present.
Great. Thanks so much, Brennan. 1 minute, if anybody has a question they want to throw out. But again, we can, Brennan can ask questions on or answer questions on the panel and breakout rooms too.